Hi everyone, Dr. Po Raval. What is a gait analysis and why is it important? That's what we're going to talk about today. So, what is a gait analysis? In a short sentence, a gait analysis is an analysis of the way you walk. In some cases, run, and it is there for three reasons. It's to figure out what's causing your injury. It's to figure out how to make you more efficient in what you're walking or running, and it is to improve technique. Those are the three reasons for a gait analysis. So what is it exactly? So sorry, I don't have great visuals on this, but there are three phases to a gait analysis. Number one, there's heel strike. That's when you hit your heel on the ground, your foot moves to what's called mid stance, where the bulk of your body weight is over your midfoot, and finally you bend your toes and come off those toes. So why is that important? Because by transferring your body weight from your heel to your midfoot to your toes, you're increasing the efficiency of how you walk. You're spreading your body weight over all the muscles of the foot. That's number one. You want three phases of gait. When we see a lot of people with flat feet or high arched feet, we often find they either walk like this, flat-footed, or they hit their heel, they hit their forefoot, but they're not using the whole foot. So our whole goal is for you to use all three phases of gait to make you walk or run faster or more efficiently, which means walking with less injury. Also, there's natural shock absorption built into the arch. These are all musculature in here that helps you bear weight and gives you natural shock absorption. So what do we look at when we look at someone's gait? First, I look at how far or how long your stride length is. That means when you hit one heel to the minute you hit the other heel. Some people put midfoot to midfoot. That stride length can be changed. So when I find somebody is walking very flat-footed, I try to increase their stride length because it forces them to come off their toes to move forward. So there are a lot of little techniques that you can do to increase or decrease stride length to make you more efficient. Number two, joint angles. So the joint angle is the angle between the bone of one area to another area. In the foot, it's the shin bone to the top of the arch. If you're flat-footed, this is a higher angle. If you're high arch, this is a lower angle. So we look at the angle of the shin to the foot, and we try to make that close, I would say, to 90 degrees. So when you first land, you kind of want to be at 90 degrees. We have found that most orthotics are casted in that position, and it helps you walk more efficiently. We also look at the hip, the knee, and the ankle joints and see that they line up. Lastly, the pattern of foot contact, as we talked about, high arched, normal arch, low arch. And what you do with those arches once you land matters. If a flat footed person pronates, they bend in on the arch. If a high arch person supinates, they go to the outside of the arch, and usually either one of those produces more injuries. So in a nutshell, that's why we look at gait, increased efficiency, reduce risk, improve your technique, and we're looking at the length of the stride, the joint angles, how your hip, knee, and ankle function together, and the contact position of your foot. Hope this is very helpful. It's being used more and more.